Good afternoon. It's great to be with all of you today for this week's COVID-19 briefing. As always, I'm pleased to be joined by our Public Health Commissioner, Dr. Michael Mendoza. This week, with Halloween just days away and Thanksgiving in just a month, I find that there's a lot of discussion around how we're going to celebrate and whether or not we can celebrate safely. My office has received a growing number of questions and concerns about how we can celebrate holidays this year, particularly in light of the increase in COVID-19 cases we're experiencing in Monroe County over the last few weeks. And these are really tough conversations and challenging questions to answer. And they're the same ones, though, that we've been having over the last 7 months. Before it was Easter brunch and picnics on Memorial Day or the 4th of July, and now we're talking about trick-or-treating and Thanksgiving dinner. And like everyone else, I want to be able to celebrate with my family. That's what holidays are for, spending time with people that you care about most. We can still do that, but there are important questions we need to ask ourselves before doing so. What are the risks involved? How can we celebrate with minimizing those risks? And what safeguards do we have in place? And how do we make sure that we're not infecting our loved ones unintentionally? Certainly, we know more about the virus today and how it spreads than we did back around Easter time. We know that when you add more people from outside of your immediate family, the risk of spreading the virus increases. This is even truer now as winter approaches and we're gathering indoors more. But what does that mean for your 25-person family that you'd like to have over for Thanksgiving? Now, we cannot tell you exactly what to do. People have always asked me, what's the appropriate size? Is it safe to have 15 people over? Is it safe to have 25 people over? I can't tell you exactly what to do, and neither can Dr. Mendoza. But what we can do is give you some things to consider and talk about the risks. If the positivity rate of 2% means statistically, it means 1 out of every 50 people statistically could be infected. That means the larger the gathering, the greater chance of someone being infected and creating a spread within that gathering and with that family remains. And that's about where we are today. But a month from now, when we're all planning on celebrating Thanksgiving, that positivity rate could be at 3% or 4%, which would mean an even greater risk of someone being infected and contagious. So that's the risk factor and the way that you can read what those infection rates are and what does it mean to you and your family and the groups that you have coming together and being together with people. If you take it out, it's all about mitigating the risk. Another factor we have to continue to consider is who is becoming infected. We've seen an increase in 30-year-olds, 20-year-olds, and teens in our positive cases. And as those age populations begin to interact with our seniors or people with underlying conditions, the risk factor certainly goes up. So at the end of the day, this isn't just about protecting ourselves. Wearing a mask, keeping social distance, and using hand sanitizer is not a selfish need. It's about protecting the people that we care about the most. It's about protecting your family. It's about protecting your community. So what do we do? Well, we start by wearing those masks. We maintain social distancing and all of the other steps that have been recommended by our health professionals, because we know and we need to continue to double down on our efforts to do that, because we know that COVID fatigue is a real thing. Everyone I know is tired of the new normal and wants to get back to the old ways of doing things. I want that too, but we're just not quite there yet. We will get there, but just not today, tomorrow, and it may not be next month either. But we're going to continue to work together. We're going to continue to follow the guidelines, and we're going to continue to mitigate those risk factors to lower the spread, keep our numbers low, and keep our families safe. Because it's also important to understand that the actions that we take today are what is going to inform our numbers a month from now. So we want to have a safe Thanksgiving. We want to be able to be with our families. And the actions that we take now will inform what that positivity rate looks like a month from now. So it's important to understand as you're gathering and as we approach Halloween this weekend, it's important to understand what we can do to avoid the risk of spreading the virus. It all starts with minimizing large gatherings that are outside of our family, keeping the 6 feet apart, and wearing the mask. I also want to update the community on where we are on two important initiatives that we rolled out over the last couple of weeks. The first one is the Small Business Grant Program that we announced last week. To date, we've had 1,200 completed applications. Many more are in various stages of completion and being filled out, but we've had 1,200 completed applications to date. The application period is still open, and small businesses up to 50 employees can still apply by going to our website at www.monroecounty.gov/fastforwardmonroe. Again, you can link to that through our website. And the application period is still open. The Small Business Grant Program, it will help small businesses in our community. They have up to 50 employees with grant sizes up to $20,000, depending on the size of your business. We also, a couple weeks ago, started a new eviction and foreclosure prevention program to help individuals in the community who've been impacted economically to be able to stay in their homes. So far to date, we've received roughly 3,000 applications for assistance from the community, and the applications for those is still open and available. And I know there's been a lot of talk about eviction prevention, and the deadline for evictions has been extended to January 1st, but this can also help homeowners who are facing foreclosure. So if you are facing eviction or foreclosure because of the economic a downturn in economic result of COVID-19, you simply need to call 211, and it's a streamlined application process and screening process. So I would encourage all residents who are facing eviction or foreclosure right now due to COVID-19 to please call 211, and the screeners and the folks who work there can help work you through the process, and will get you to the community-based organization that can help with make those past payments. So I want to get that information out there. I'm now going to turn it over to Dr. Mendoza, our Public Health Commissioner, who can talk about what we're seeing in the numbers and what it all means.
Thank you, Executive Bello, and thank you again to all of our local media for making the time to join us to engage in these important discussions. With Halloween this weekend, with college students coming home, with Thanksgiving around the corner, I'm growing increasingly concerned about bars. Now, let me be clear. I think most bar patrons, most bar owners are doing the right things, and I believe that because we have not yet to date seen major spikes affiliated with our bars. That being said, as the cold weather sets in, I think more people will be coming inside, and enclosed spaces like bars, many of which are fairly small, are typically more risky than the typical outdoor setting. First, we know that when we go to bars, we often go to bars to meet people who are outside of our household. This can present an additional risk. And let's be honest, when people are drinking alcohol, they may not always make the best choices. And even if they are making the right choices, we can't be sure that those around us in a bar are also doing the same. So I'd like to spend a few moments thinking about the risks, about whether or not we should be going to bars. First of all, think about if there are safer alternatives. For example, gathering around a fire pit in your home with a small group of friends who are socially distant, people that you might know, that might present a lower risk than going to a typical bar. I know, however, that many people will still consider going to bars. And so I'd like to spend a few moments today talking about what you can expect and what bar operators should know when operating a bar, so that we can do everything we can to keep our patrons safe and ultimately to keep our bars open. In terms of capacity, the capacity should be no greater than 50% of the maximum occupancy as set by your certificate of occupancy. Masking, employees should always wear a mask, face covering that covers both their nose and their mouth. A plastic face shield is not a substitute for a face mask. It can be worn in addition to a mask, but the mask is still necessary. And I urge all bar owners and all bar patrons to be observant of this. And we want to make sure that we enforce mask wearing as much as possible, except when you're seated consuming. Social distancing is very important. Tables must be at least 6 feet apart, and at the bar, patrons who are not part of the same party should remain 6 feet apart from one another at all times. Bar staff should stay away from patrons as much as they can. And remember, if those sitting at the bar don't have their masks on, they could be putting yourself or the bartender at risk. Consider putting plexiglass barriers between the bartenders and the patrons, and consider checking every party in at the door, getting a contact name, perhaps a phone number for each party, the time when they visited, and the time they left. Perhaps consider paying attention to who was serving them. All of this sounds like a lot, but the reality is if we have to issue a media advisory in the case of a positive case, we will be less likely to need to do so if we have this ability to obtain this information from the bar, and that would negate the need for having to make an announcement publicly. So these are just a few steps that you might consider to reduce the risk and to help everybody stay safe when we attend bars. I also want to touch briefly on our recommendations from yesterday regarding universal masking recommendations for childcare providers. First of all, I want to clarify that this has been recommended by the CDC all along. And in reality, we've been hearing a lot more concerns from the community on both sides about whether this should be in place. We did not institute this in response to any increase in numbers of cases, though I will say we have seen cases of individuals in childcare settings, both the providers as well as the children. And so we want to do everything we can because the reality is that we don't know truly what the prevalence rate is in childcare settings because the vast majority of these youngsters are very likely to be asymptomatic carriers rather than have symptoms of COVID-19. And I will say that many of my colleagues in healthcare, many parents have expressed their concerns and some uncertainties about taking their kids to childcare. And now is the last time that we want to do anything to jeopardize childcare, because the reality is, if we need to close a childcare setting down, that's going to greatly impact a large number of families. And so we want to encourage as best as feasible. And I understand that it's not always going to be easy, but I do want to encourage as much as possible to have universal masking in childcare settings. Finally, a word about the numbers. We are seeing, as you know, an increase in numbers and a lot of fluctuations from day to day. And so we will be adding a 7-day rolling average to our daily report, which will hopefully give you a better sense of how things are going. And it will not unduly alarm or reassure because there are day-to-day fluctuations that we see. In terms of the zip code maps, we've added a map that shows the rate by zip code. As you can imagine, yesterday you might have seen a couple of our zip codes turn a different color, indicating that they had more cases. It turns out that a lot of the zip codes where there are more cases happen to be more populated. And so it shouldn't be a surprise that we'll see more cases there. But the hope is that in showing the rate, we'll be able to paint a much more accurate picture, because the reality is there are some zip codes that are not that populated that actually end up having a higher rate than some of those perhaps in the city or that are more populated. So with that, I'm going to turn the microphone over to Julie for our questions.
Okay, thanks, Mike. We will start with Patty Singer, the Minority Reporter.
Oh my gosh, I have never let off in my life, including wiffle ball.
You're number one today.
Oh my gosh. So we're getting close to the end of the marking period for the city school district, and they had talked about they wanted to look at 10 weeks and see. With our numbers changing, with holidays coming up, with the potential for gatherings, if you were to get a call, or if you have gotten a call from the superintendent, what would you say, what have you said about considering in-person hybrid for the city school district?
Well, I know that the desire has always been there, and the reality is that it's just difficult. There are a lot of concerns in the city. All of the factors that we know of in the city are making things a little more complicated there for our city school students. But we know that we very much care both for their mental health and how they're doing at home in this very difficult environment, as well as the curriculum that they're not able to experience when they're in person. And I'll let Superintendent Myers-Small talk about that to you all more directly, but we have been in contact, and I've been offering all the same guidance that I've offered to all of the other school districts around masking and precautions that can be taken in the schools and transportation and busing and so forth. But I do know that they're working very diligently on this problem.
Do you see something coming up in that, are you preparing for an announcement in that, in a couple of weeks at the end of that marking period, or is it still going to be a work in progress?
I imagine that they will be in touch. I understand the marking period is soon to be over, so I'd anticipate that they'll make an announcement in the near future.
Thank you.
Thank you, Patty. Randy Gorman or Alex Crichton, I'm not sure which one of you is on, from WXXI.
Hey, Julie, it's Alex. Randy's working. I'd like to ask you, Dr. Mendoza, about participation in WROC It looks like it's more than doubled recently. Can you speak to the importance of this screening tool and how can this information from that help the medical community?
Well, we are still digging into those data, but we are starting to see a correlation between the responses on rockcovid.org as well as what we're seeing in terms of cases. And this is, not what we were hoping for, but this is what we were hoping for in terms of the utility of this app. When we see more symptomatic individuals, that will allow us to identify potentially areas of concern. We don't yet, unfortunately, have enough participation in this to be able to get to that level of a granularity in terms of outreach, but certainly there is a correlation between what they're seeing and what we're seeing. And so I think that validates the method. I think that is proof that we ought to be encouraging everybody to get involved, because as we have more numbers, our ability to drill down into smaller areas and do further outreach and focus testing, when we start looking at these microclusters, I think all of these data will be very important to us. Because at the end of the day, we don't want to be driving blind. We want to be able to have as best available information as we possibly can.
And I was just thinking the other day, where do we stand right now compared to last March? I mean, is it worse right now?
It's totally different. Last March, we didn't know very much about this virus. We didn't know about the precautions that made a difference. We certainly didn't have all the experience that we have with contact tracing. And so while I think the similarities are tempting, I think the reality is we're in a very different place. We know a lot more. We are better able to treat. We certainly know more about prevention, and we're testing a whole lot more than we were. So where we do struggle, though, is pandemic fatigue. We didn't have pandemic fatigue in March, and we certainly have it now. And that is the area of greatest concern for me, because ultimately, we as a community control our own destiny. The outcome will be a function of how well we come together again, like we did in March and April and May. And I realize it's hard, but ultimately it is what we have to do in order to prevent having to flatten a curve again.
Thank you.
Thank you, Alex. Andrew Banis from 13 WAM.
Hey, good afternoon, guys. Wanted to ask Dr. Mendoza, actually, Patty, you brought it up, but I'm seeing on the Rochester City School District website that they have announced that they will be going fully remote through the end of the year. After seeing that, is that something that you think, if numbers continue to rise, you will make that recommendation like you did in the spring for all districts in Monroe County?
Is that for me or for Adam?
Well,
both if possible.
Well, I guess why don't you start off, Adam?
Well, no, I can let you talk about. What I would say is each district is going to make its own decision based on what the condition is within its district. This is the approach that has been taken right from the beginning. Statewide, when you talk about regional responses, and then digging in being the regional response, then we're looking at county response, and then you're looking at micro clusters, you're looking at school district responses. So you're drilling down and getting narrower to prevent having to do widespread closures. So I think each school district is going to have to take a look at the various challenges that exist within each one to make that decision. What's the best decision for those schools? And the other, there's a lot of different factors that go into that related to school size, space that's available, how you can, reduce class sizes and what that looks like, which is why you see different school districts across the county and the region have all different experiences right now.
That's right. And the one thing I'll add is that you'll recall in March, we didn't know anything about the community transmission rate. And so the reason we went, widespread closure was because we just didn't know. And we're in a very different place now. We have much better data, which will allow us to be more targeted in our approach.
And thank you, guys. And a follow-up to that would be, is there anything like, Dr. Mendoza, I know you brought up bars or something you're keeping a close eye on. Is there an order, like maybe a list of priorities of what you would recommend maybe needs to close down first, second, third, bars being the least essential? Now, no offense to the bar owners, but as opposed to schools, and you'd want to keep those open as long as you possibly could. Is there like a list of priorities you would want to check down of closures or recommending closures?
Well, I think the way we approach the reopening with phase 1, 2, 3, 4 is a reasonable way to go in reverse if we ever needed to. We all want schools to be open. We all care about our children. Generally speaking, I would put them at the very end, frankly, because they've proven that they've been able to keep the infection rates low, and schools are vital to our children's experience and that of families. But as far as how everything else might lead up to that, I think that's a conversation that we're having, certainly within the control room, working in concert with the governor's office and our colleagues across the region. But in general, I think the way that the phase is reopened is a reasonable approach, but I think we'd want to take it on a case-by-case basis at this point.
Thank you, guys.
Thank you, Andrew. Jennifer Lukey from WHEC.
Hello, good afternoon. Dr. Mendoza and County Executive Bello, for months you both have been preaching education over enforcement. But now that we're seeing sort of a blatant disregard in some cases for the rules and regulations that have been set up, when does that enforcement get stepped up? I know the governor is very specific about wanting counties to do more on enforcement. And I know we've asked you about this many times, and you said you're really trying to work with business owners, but what do you say to this?
Well, enforcement is important. I will just say this, though. Regionally, it's very different. In Monroe County, we haven't really seen what you've seen in a lot of other places. We've had a lot of participation and by the community, by the business community, and by our residents. And so we haven't had to take those steps yet, but we will if we see the executive orders that the state has laid out violated. There will be enforcement actions, but we just haven't really we just haven't seen that a lot here, just because there's been a lot of participation. Our numbers have also been low, lower than a lot of other places around the state, even in our region. And I give a lot of credit to the community for doing that. Our contact tracers, I think, are really doing a great job at the Department of Health. And I think the education first approach has been working here in our region.
Okay, do you have a follow-up, Jennifer?
Yeah, I didn't know if Dr. Mendoza, did you want to address that? I mean, I guess education, there's no excuse at this point, though. It's been 7 months in a pandemic. Everybody should know what's allowed and what isn't.
Yeah, everybody should know what they need to do. The rules are clear. Everybody should know what they need to do. And and I ask people to think about it this way. The way this has been managed, remember, we know a lot more today than we knew earlier this year. Right? Dr. Mendoza said that earlier. So at the beginning of the year, when the pandemic first started, there was basically a shutdown across the board of all non-essential, really, activity. And then as we learned more about the virus, how to control the spread, parts of the economy and different things were opened up in phases. Then once you get through the phased approach of reopening, then we identified regions. So we have the Finger Lakes region, there's Western New York, there's Hudson Valley, so that the state decided to put us into regions. Beyond those regions then, now we're looking at the cluster strategy. So how do you attack where the positive cases are as clusters? So it's gone from here, the big shutdown, gets smaller and smaller and smaller. I think that's a smart way to do it, because that's the way the science is directing us, and I think that prevents then those full widespread shutdowns. But what I'd ask people to do is think about their actions this way. Wearing a mask, so when I put my mask back on when we're finished with this isn't necessarily just to protect me. This isn't a selfish action. It's an action to protect all the different people around me. And that's why we're participating in this. And I think that's why we've had really good participation here, is because people know that. So when you go into a bar or you're in a restaurant, and the rules are when you walk in, you're wearing a mask, or you have to sit down, or there's a reduced capacity. You're not doing that out of some selfish need to feel good. You're doing it to protect the community and be able to keep us open. The problem is going to be if you violate what the science is telling us. When the science tells us you have to wear a mask, you have to stay a distance apart. When you violate that, you risk, and we talked about what risk means earlier, you start to now enter what is the risk? What is the risk of spreading it? And then if it spreads, then you're going to have to start then you're going to have to activate what are those cluster controls, and then what happens as a region, and then what happens as a state. So I would go back to the message to the community, which is that wear your mask, follow the guidelines, and the actions that we take today will protect people around us, and they'll also inform where we stand a month from now. That was, I think, a big piece of what we were talking about earlier this year, when our numbers were very high. We're infecting people, or people were becoming infected that were older and also had health conditions. We're largely keeping it away from the older population right now. A lot of our numbers are younger population, but it's still spreading, and we're starting to see those numbers go up. And the real issue is keeping it away from them. So I know enforcement is always at the top of everyone's minds. There will be enforcement if it becomes necessary, but we've taken that education approach first and really stressing upon everybody, this is a community initiative. This is a community problem, community challenge, and we're all working together. It's largely worked, but we have to keep going. COVID fatigue, which I know Dr. Mendoza mentioned earlier, is real. You know, everyone's sick of doing this, but the fact of the matter is, because we've been so good at working together and collaborating and getting to this point, we've actually fared a lot better than a lot of other regions around the country.
So I'll just add that enforcement is never the first thing I consider. You know, first and foremost, I'm a physician. And when I have a patient who is making decisions that I think are not in the best interest of his or her health, I want to figure out how I can connect with that person in a different way. And I don't view my role as Commissioner of Public Health that differently. When I see these examples of people making unhealthy choices, I look inside and I say, what can the health department do to connect better with that bar owner or that restaurant or that business or that community or that individual? And can we be creative and educate and motivate? But if we have to enforce, we will. And the health department is not a stranger to that. As you all know, we close restaurants, we fine establishments if we have to. I'm certainly not afraid of that, but I really would like to see us get through this without having to take that step. So we can look out for one another, because that's the right thing to do. And, you know, perhaps that's a little idealistic, but I do think that we've gotten this far using, you know, those incentives, and I hope that we can continue.
Thanks, guys.
Thank you, Jennifer. Mary McCombs from Spectrum, you're up next.
Good afternoon, gentlemen. Thanks for taking our questions this afternoon. And I'd like to start first with Dr. Mendoza, just continuing this conversation on restaurants and bars. What do you say to the restaurant owner who perhaps is doing everything they can within, you know, the guidelines that have been set for them, but yet, you know, we're starting to see recent restaurants, just this week alone, where they have had to close for deep cleaning because employees have tested. What is it that they need to be doing? I mean, I know you ran down a list in the beginning of things that could help, but what do you say to the frustrated restaurant owner who is saying, you know, I'm doing all of these things? Kind of tough to predict, I guess, what's going to happen with employees.
I say thank you. I say thank you to the restaurants who are working so hard under these challenging circumstances. And I don't actually believe that because there are cases in a restaurant that it's the restaurant's fault. Everybody is a grown-up who works in a restaurant. Everybody can make their own decisions. And occasionally when we slip up, there are consequences. And that can be any of us. But in a restaurant, it has consequences. And that consequence may be that you lose people who are vital to the operation of the restaurant, or if there are enough of them, that they have to close. And at the end of the day, nobody wants that. And so first I say thank you to the restaurants. Then I say, if there's anything that we can do in the health department to help you, to educate your teams, please let us know. But I think at the end of the day, these employees are everyday people like you and me who are going to work and can choose to make the right choices or can choose to let their guard down. And I hope that it would be the former.
And my follow-up question would be for the county executive. Adam, just curious, I know, you know, you've talked about it before. If we do start to see restaurants not able to reopen, how are we going to be able to help these businesses? I know you talked a little in the beginning about this, but just, you know, already impacted having to move from outdoor to indoor dining, the challenges of the 50% capacity.
Yeah, no, Mary, that's a great question, and you know, and it builds upon something that Dr. Mendoza was just talking about. Is that, you know, the health department stands by and ready to help these businesses when there is an issue that develops or a positive case, and they're struggling to figure out how to deal with that and get back to a level of safety. The county, on the other hand, being able to utilize the CARES Act dollars that we received, did the small business grant program that I referenced earlier. The application's open until November 2nd. Really, the idea behind that and how that came to us was because what actually came out of our meeting with restaurant owners. And one of the things we were talking about is that, over the last several months, they've made a lot of adjustments to be able to open up their business and keep their employees working and keep operating. They've made a lot of adjustments, infrastructure, other things to be able to expand outdoors and do a lot of outdoor dining. And with the winter months approaching, that's going to be harder and harder to do. And they need that little extra support to be able to do things like to purchase, the tents, heating equipment. We've seen other cities across the country do some creative things related to, and businesses doing creative things related to these igloo structures, things like that. But that all costs dollars. And so we created this small business grant program out of that conversation to be able to help those small businesses be able to adapt and make those changes and hopefully be able to continue operating as it gets cold outside. So we're trying to do it. We're trying to address it that way. So we have some financial support going to those businesses, but also the health support as well, because we want to see them open. I want to see them continue to be successful, but we have to do it safely, and we know that they need some additional support from us.
Thank you.
Thank you.
Brian Sharp from the Democrat and Chronicle.
Hello, thank you. I was wondering, first question is just, you've talked about trying to address clusters, and we are starting to hear about clusters in hospitals among staff. I was wondering if you could address what you've seen in that regard and how you're trying to tackle that issue.
Well, funny you should mention that. I just came from Highland Hospital and had an opportunity to talk to their leadership, and they are working very hard to emphasize to their nurses and to all of their staff the vital importance that they play. None of us wants to see another curve that we have to flatten. And that starts with us in healthcare. That starts with us as nurses, as physicians, as all of the different types of people that work in healthcare. I believe we have a higher level of responsibility to ourselves, to keep ourselves healthy so that we can ultimately reach out and take care of one another in our community. So I will say that both of our hospitals have had to step up their message. And I think by and large, that message is being heard.
And one follow-up also is you've talked about both, and maybe this is the county executive, about the level of cooperation you've received in Monroe County and not seeing the resistance. I don't know if you're aware, we just received a news release on this as you guys started, but you've been added to a lawsuit by a number of plaintiffs, all from what I can tell, from Monroe County, seeking court order that would essentially, this also names the governor, to lift all restrictions and bar you from enacting them. And among other things, it states that the evidence suggests this pandemic is over, and with it, any emergency powers that you might have claimed. I don't know if you can speak specifically to the lawsuit, or at least to the a little more on this faction and how much you're hearing from it that this has gone too far and there needs to be individual decisions now made.
Yeah, I'm not familiar with or aware of the lawsuit, but I can tell you the COVID-19 pandemic is real. I mean, we've seen this across the world, across the country, and across the state. And I think we've had a lot of great cooperation from residents here in terms of managing the spread. And so I'll just go back to what I've been saying this whole time, which is I think the approach that's been taken by the state, what happened earlier back in March, but then also the phased in and the regional approach and the cluster strategy is the smart and responsible way to go. Because the fact of the matter is we lost over 300 people in our community, just here in Monroe County alone, to the COVID-19. And there's people dying across the state, our county, and the country today. And we have a responsibility to protect our residents and make sure that we're following the science and what it tells us. So I think we're doing the right things. And I want to thank the public for working with us to try to protect ourselves, the community, and our neighbors.
Okay, thanks, Brian. Our final question comes from Rebecca Bath from WROC.
Well, my question, I didn't want to have to be that guy to ask that question. So now that I don't have to ask that question, I'm not going to ask any questions and just say thank you so much for your time, and we appreciate it.
Thank you, Rebecca.
Thanks.
That's it.
All right, thanks, everyone.
Thanks, guys.